So you may be wondering, why does somebody who lives in the United States care about something that's going on in the United Kingdom? Well, it's actually really quite simple. As somebody who works with an organization called Operation Bullhorn, I work with people not just in the United States, but people all over the world, including people in the United Kingdom on a daily basis. Some of these people that I work with in the United Kingdom have dealt very heavily and very personally with depression, with feelings of being suicidal, and sadly some have completed suicide. Time and time again, I'm faced with the same issue with these people in the United Kingdom. They tell me they try to get help. They tell me that they call the health nurse in order to get the help that they need, in order to get the appointments they need, in order to get the medication that they need. And they tell me they either are not called back or are not made a priority and not taken seriously. Thankfully, we have members in our group who have been able to call emergency services at times when several of these individuals have attempted to take their life. Unfortunately, emergency services, though they did show up at the individuals' homes, did not do anything further. They did not admit the person to the hospital. They did not carry the person to the hospital. Once they saw that the person was alive and, as far as they were concerned, okay, they simply left. This is a situation that needs to be resolved. People with mental health issues, people who are depressed, people who are suicidal, aren't always going to be able to reach out for help. If they want to end their life, if they think their life is that horrible, and that ambulance comes to that door, they may try to pretend like everything is okay. Health professionals need to be trained properly in how to deal with people who are suicidal, how to deal with people who have mental health needs, how to get medication to them, how to get the help to them that they so desperately need. And this simply isn't being done. What I'd really like to see happen is a complete reevaluation of the system that's in place right now. I'd like for them to ask citizens their opinions on what's working and what's not. I'd like them to speak to the healthcare professionals that are giving treatment to these individuals and find out what's really going on, find out what the problems are, find out what needs to be corrected. If the citizens aren't spoken to, the problems aren't going to be known and the problems aren't going to be corrected. But they're going to be seen by people all over the world who care enough to try to reach in and help. Please stand with us and try to get an end put to some of this suffering. Try to get help to the people that need it. Please help us change this system.